1. A client with pneumonia suddenly becomes restless and confused. The respiratory rate is 32 per minute and SpO2 is 86% on room air. What should the nurse do first? A. Notify the healthcare provider. B. Apply supplemental oxygen. C. Obtain a sputum specimen. D. Administer the prescribed antibiotic. Correct answer B. 2. A client with heart failure reports increasing shortness of breath. Which finding requires the nurse's immediate attention? A. 2+ bilateral ankle edema. B. Weight gain of 1 kilogram in 24 hours. C. Pink, frothy sputum. D. Fatigue when walking. Correct answer is C. 3. A postoperative client suddenly develops chest pain, dyspnea, and a heart rate of 124 per minute. What is the nurse's priority action? A. Encourage the client to cough. B. Place the client in a high Fowler's position and administer oxygen. C. Give the prescribed opioid. D. Assist the client to ambulate. Correct answer B. 4. A client with diabetes is confused, sweating, and trembling. The blood glucose is 48 mg per deciliter, 2.7 mmol/L. The client is awake and able to swallow. What should the nurse do? A. Administer IV insulin. B. Give 15 grams of a rapid-acting carbohydrate. C. Give glucagon immediately. D. Restrict oral intake. Correct answer is B. 5. A client with a head injury becomes increasingly drowsy and develops unequal pupils. What should the nurse do first? A. Reassess the client in 30 minutes. B. Administer pain medication. C. Notify the healthcare provider, emergency team immediately. D. Encourage oral fluids. Correct answer is C. 6. A client with chronic kidney disease has a potassium level of 6.7 MeQ/L, 6.7 mmol/L. Which finding is most concerning? A. Muscle weakness. B. Nausea. C. Peaked T waves on ECG. D. Increased thirst. Correct answer is C. 7. A client receiving a blood transfusion develops chills, fever, and back pain 15 minutes after the transfusion begins. What is the nurse's first action? A. Slow the transfusion. B. Stop the transfusion. C. Administer acetaminophen. D. Obtain another unit of blood. Correct answer is B. 8. A client with COPD is receiving oxygen. Which finding suggests the client's condition is worsening? A. SpO2 of 90%. B. Mild exertional dyspnea. C. Increasing drowsiness and confusion. D. Productive cough. Correct answer is C. 9. A client receiving morphine after surgery has a respiratory rate of 7 per minute and is difficult to arouse. What is the priority intervention? A. Give another dose of morphine. B. Administer naloxone as prescribed and support ventilation. C. Place the client flat. D. Encourage oral fluids. Correct answer B. 10. A client with a gastrointestinal bleed has BP 82/50ths of a millimeter of mercury, HR 128 per minute, and cool, clammy skin. What should the nurse prioritize? A. Encourage oral fluids. B. Prepare for IV fluid, blood replacement and notify the healthcare team. C. Give an oral iron supplement. D. Obtain a stool sample. Correct answer is B.